Hi, today we're going to talk about choosing a provider for your CRPS. This is one of the most important decisions that you'll be making, and I'm going to go over what the categories are of providers. So, there's obviously physicians, and there are different types of physicians that treat CRPS. There's the pain management doctor. These are usually anesthesiologists who take additional training on pain management. Physiatrist. A physiatrist is a physician who specializes in rehabilitation medicine, and a neurologist. This is a specialist who treats things in the nervous system. There's also a physician assistant. They are able to diagnose illnesses and make and manage a treatment plan with a supervisory physician. PAs are found in different specialties, including pain management, neurology, and physiatry. PA's educational process is less than that of a physician and does not include a residency. Nurse practitioner. This is a master's level nursing education. An NP can also diagnose, write, or follow a treatment plan. The NP works under the supervision of a physician and can also work within crap. How the beat do I stop this from recording? All right, well, we got to do this over now. Hi, today we are going to talk about providers who can provide care for someone with CRPS. This is a very important decision and maybe the most important decision you make about CRPS. A lot of times, the practitioner that you choose will also determine the treatment that you receive. So the practitioner types are physician. There are different types of physicians that treat CRPS. A pain management doctor. These are usually anesthesiologists who specialize in pain management. Physiatrist. This is a physician who specializes in rehabilitation medicine. And a neurologist. This is a physician who specializes in the nervous system and its diseases. A physician assistant. They can diagnose and make and manage treatment plans under the supervision of a physician. PAs are found in different specialties such as pain management, neurology, or physiatry. The PA's education process is less than that of a physician and does not include a residency. A nurse practitioner. This is a master's level of nursing. The NP can diagnose, write, or follow a treatment plan. The NP also works under the supervision of a physician. And the NP can also work within a specialty practice. Specialists. There are very few medical professionals who specialize in CRPS. Many people select a medical professional based on the treatment they desire. There are several Facebook groups on different types of treatment of CRPS, and you can always ask for their opinions about providers. You can also ask your primary care provider. It is important to find a primary care provider who's either treated others with CRPS or is willing to accept information and educate themselves. I personally have spent a lot of time educating my primary care doctor over the years, and she has gone on to actually diagnose several people with CRPS and send them to the appropriate specialist. Building your healthcare team. It's important to have a primary care provider. You should find a physical therapist who has treated others with CRPS. And then find a specialist, either word of mouth from others with CRPS or a recommendation from your primary care doctor. Your first visit, you should go in with a list of questions. I always bring a list of questions with me for every doctor's appointment. That way, I don't forget something. Do not expect everything to be accomplished on the first visit. It will take time and several visits for you to build a rapport with your provider. Don't miss appointments and try to get them as soon as you can. Sometimes you may be able to get several appointments at the same time, a few weeks apart, in order to ensure that you are able to see your doctor or nurse practitioner regularly. Interviewing a specialist. Get recommendations from others in your area with CRPS, but note you may have to travel in order to find someone who is a CRPS specialist. Start the process by calling their office to see if they are accepting new patients. Make an appointment so that you can interview the healthcare provider. Once at the office of the healthcare provider, here's some examples of questions you would want to ask. Is this a group practice? If so, who would care for you if your healthcare provider was not available? Do they have admitting privileges at a hospital? If so, which one? What is their experience taking care of people with CRPS? Do they have any special training or certifications? And what treatment do they recommend or do they offer to CRPS patients? Creating a team. Before interviewing a healthcare provider, you need to be prepared with the following things. You need to have a list of your current medications, your medical history, a list of medications that you've tried but did not help, activities that make your pain worse, activities, if any, that improve your pain. Rank your pain on a scale of 1 to 10. The effect of therapies on your pain in the past. Keep track of what triggers you and any patterns of pain in response to medication or therapy. It may take you a little bit of time to gather all this information so that if your provider can't see you for several weeks, you'll have that time to get this information together. It took, for me, 2 years to get my diagnosis. I saw a variety of physicians, most of which were orthopedists, since my injury was an orthopedic injury. There was no social media in 1996, so it made it difficult to connect with others with CRPS. It was actually 5.5 years into CRPS before I met someone who also has CRPS. Now you can connect with people through social media. I was fortunate to be referred to a chronic pain center. Chronic pain is defined as pain lasting 6 months or more. At this outpatient center, I was diagnosed. I was fortunate enough to live in the Philadelphia area, but at first I was unable to see Dr. Schwartzman as he was not taking new patients. But I was able to see someone in his practice. When in Philly, my primary care physician had a mom and a sister with CRPS, so she was very familiar with it. As I grew more knowledgeable about CRPS, it became less important for me to have a primary care physician who knew about CRPS, and more important to find one who was open to learning about it. I went to nursing school from 1989 to 1995, first at a community college to get my RN, and then at Villanova University to get my BSN. There was no mention of CRPS at either school in either program. After my diagnosis, I called one of my professors who had her PhD in pain management and offered to bring snacks and talk to the students during a break about CRPS. The reply was, if it's not on the boards, we don't teach it. And I found that very disturbing because there are a lot of people with CRPS, and if you don't know anything about it, how do you properly take care of them? So one of the reasons for this channel is to spread awareness to others with CRPS, family members, physicians, nurses, etc.